What is up, guys? My name is John Evans, and I coach three of the highest jumpers in the world: Donovan Hawkins, Tony Crosby, and Isaiah Rivera. In today's video, we are actually going to be talking about the meniscus. And before we get into that, there are 5 things that you need to understand about this structure. The first is that it is made of a different type of collagen, collagen 1, which is not collagen 2, similar to what you would see in articular cartilage. Now, what that means is that its function is going to be slightly different than what you would see in a tendon or articular cartilage. The second thing you need to understand is that the meniscus does not just function to support the knee in compressive loading. It also has different ligaments attached to it called the meniscus roots that help assist the ACL and PCL in staying in place and then giving it a little bit more stability. The third thing you need to understand is that the meniscus does have a blood supply to it. There are arteries that supply the meniscus, specifically the superficial portion, with blood. Fourth thing you need to know is that even though the whole meniscus does not have an actual blood supply, it does have something called synovial fluid weeping from it that allows it to receive other inflammatory markers that once again can help the meniscus repair itself. Now, the fifth thing, which I alluded to a little bit earlier, is that the meniscus is made up of 2 major types of tissue. One is a ligamentous portion, which is the root. That is what anchors the meniscus to the femur and to the tibia. And the cartilage, which is the fibrocartilage, similar to what you would see in the spine, which actually does help with the compressive sort of shielding that is necessary whenever we run and jump. Now that we kind of understand what the meniscus looks like and the structure of the meniscus, we can talk about the mechanism of injury. Now, this is a little bit controversial because there are a lot of people out there that will actually say that you need to load it inside of these very intense positions to allow that tissue to adapt, and ultimately we use graded exposure to see it improve its function over time. Now, the mechanism of injury is either a shear force, which is going to be a sliding of the tissue. So if your tibia was to move forward and your femur were to move backwards or side to side, and then a twisting. So if you saw the meniscus or the tibia and the femur rotate in opposition of each other, those are the 2 mechanisms, and specifically when you have very high axial loading. Now, axial loading can mostly be seen when you're looking at a load placed on the back. So specifically if you're doing a deep squat, if you were to be in a kneeling position, all of those positions would put a lot of pressure on the meniscus and could lead to an injury to that area. Now, it does make sense that if you were to look at graded exposure therapy and you were to say, well, if we kind of take steps back from these intense positions, we know that it is going to load it and that will potentially allow it to repair itself. But as we previously stated, the synovial fluid does weep out of the meniscus and it can allow for tissue repair, and we may not necessarily need such intense loading to get the synovial fluid to come out of that tissue and potentially allow it to have an inflammatory response inside of the knee and obviously allow for repair. Now, when it comes to the actual meniscus root, that is slightly different. That is a ligamentous tissue. Again, it does help the knee form a stable kind of surface between the femur and the tibia. It also assists the ACL and PCL in providing stability and rigidity to that joint where needed. Oftentimes, when you're seeing an injury to the actual cartilage, it's usually typically the result of overuse injuries, but it also could be due to an impact or a collision. We see a lot of meniscus root injuries, though, whenever athletes have an actual collision, whether that is in a sport or it is a skier going down a hill and they land off a jump and they twist. Again, you're going to see those twisting forces, very high axial loads. In this case, gravity is applying that axial load to your body. You're accelerating downward, and then you could potentially twist, or you could see that translation of the femur and tibia. Oftentimes, when we do see a meniscus root injury, we're also going to see an ACL injury. We're also potentially going to see the medial meniscus or lateral meniscus cartilaginous tissue potentially tear, which obviously is going to be really bad when it comes to forming a stable joint and feeling comfortable in things like running and jumping. So that all said, I have dove into the research over the last 24 hours and really looked into whether or not you can actually make your meniscus better or healthier without surgical intervention. Now, I will say there is a lot of convoluted research on both sides, but the research does indicate, when looking at a meta-analysis, which is a bunch of studies kind of accumulated together, that it is possible to have similar outcomes with surgery as non-surgical interventions, meaning rehabilitation or something along those lines. Now, if you're looking specifically at what types of non-surgical interventions they're doing, honestly, they're just doing resistance training, typically across 3 weeks, usually loading it every 48 hours in some sort of basic fundamental strength training. Now, I will say most of the studies I saw were looking at non-athletes and people in their 40s with either degenerative issues in the meniscus or some sort of osteoarthritis or things along those lines. But it is very apparent that regardless of male, female, or even age in some case from 40 to 69, that these rehabilitation programs are very effective in decreasing pain, increasing output, and overall quality of life and function. Now, I will say when I looked at the research, there was some evidence that indicated that getting surgery a little bit early on is going to be better for specifically meniscus root injuries. So if you have that ligament tearing off or something along those lines, it does appear that some of the surgical interventions are a little bit better when they're used earlier on after the onset of that injury. However, again, we do see these scenarios specifically when there's damage to the actual cartilage where that tissue can repair itself through just consistent strength training. Now, when it comes to actually getting back to jumping, oftentimes when you look at the research, they're slowly implementing that 4, 6, 8, and 10, 12 weeks down the line until that athlete is able to actually handle elastic type loads. So it's very similar to what we do with a muscle or what we would do with a tendon. At least that's what research is indicating. And that would be my recommendation to you guys out there who maybe have a meniscus injury. So in conclusion, like I said, the meniscus is a structure involving cartilaginous tissue and some ligamentous tissues anchoring it to the tibia and femur. It can repair itself. It does have a blood supply to the superficial portion, and it is able to get an inflammatory response through the synovial fluid. Yes, you can assist your meniscus in getting back to a functional, or yourself in getting back to a functional level through resistance training, but it does appear that surgery sometimes can be a good option for some athletes, specifically if they have a root tear. That said, guys, thanks for watching. Go to THPStrength.com if you're interested in getting coached by myself and Isaiah Rivera, and I will see you guys on the next video. Peace out.